Hi, my name is Adam and I'm a first year nursing student at the University of Adelaide. As a part of our health and assessment course, I'll be teaching my colleague Victoria how to administer oral medications. So as you may know, medications come in many forms. They can be in the form of a tablet, oral liquids to patches. Today though, we're going to be looking specifically at oral tablets to take. So where we're going to start first is looking at the 6 rights of medication administration. So there are 6 rights that we adhere to when we administer medications to a patient. The first right is the right medication. So just for an example today, we're going to be looking at the drug paracetamol. We have a drug chart here that shows that paracetamol has been prescribed. Its route here is oral, and we can see that 1,000 milligrams is to be given at 8 o'clock in the morning, and it's for pain. But what we first want to confirm is that we have the right medication. So that would be us looking at the box of tablets, and we can see that this is paracetamol 500 milligrams. So we can confirm there that this is the correct medication. We move down to our second right, the right dose. Now we can see that the dose here is 1,000 milligrams. However, these tablets only come in 500 milligrams. So that's going to indicate that they will require more than one tablet. And there is a drug calculation we can do for this. We can see here the drug calculation that we've done is the dose prescribed over the stock on hand. So in this case, the dose prescribed is 1,000 milligrams and the stock on hand is 500 milligrams. So we can do some cancelling out. So we can do our 1,000 over 500. We can cancel that down to 10 over 5, and that can then be cancelled down to 2. So we know that 2 tablets are to be given to the patient for the correct dosage. To ensure that you have the correct patient, you can check against the medication chart and their ID bracelet. So you'll be able to confirm details like their UR number, their first name, last name and date of birth. We need to at least confirm those 3 there to make sure that it is the correct patient. Next we move on to the right route. So as you can see, we have paracetamol to be given orally, and these will be in the form of tablets. The right time is right number 5, which we can see here is to be given at 8 o'clock in the morning. One thing to note is if your patient is fasting or if they're not to be taking any other medications with that medication. The last right is the right number 6, and that's the right documentation. So once we've dispensed the medication, we will then sign off on the medication sheet, so 2 registered nurses, and then we can ensure that it has been properly documented that the patient has received their medication. So moving forward, we then can look at further checks. So we can look at allergies and making sure that the tablets are not expired. To ensure your tablets are not expired, you can look at the packaging, and we can see here that this has an expiry date of December 2021. So they're perfectly in date and safe to use. If you're not sure on what the medication is or its effects and how it works in the body, I'd strongly recommend that you go to the Australian Medicines Handbook or MINS online. It's really user-friendly. You can type in the name of the drug and it will talk to you about how it works, what its common side effects are, and common dosage recommendations. So before you administer the medication, it's important that firstly we use hand hygiene and that we also obtain the consent from the patient. So I'm going to demonstrate now how to administer these 1,000 milligrams of paracetamol. So firstly, I'm going to hand sanitize. So to deliver the medication, we'll be using these plastic clear pill cups. So I'm going to open the package now of paracetamol. Now you can look at the back of the package too. This confirms it is paracetamol and at 500 milligrams per tablet. So we've done our drug calculation. We know that we need 2 tablets. So I'm now going to dispense these into the cup. Here we have our 1,000 milligrams of paracetamol that's ready to be given to our patient. So once we enter their room, standard procedure will apply. We'll introduce ourselves. We'll do hand hygiene. We'll obtain the patient's consent. We'll ask them if this is their first time taking this medication, and if it is, we can give them some education around how the medication works. We can also talk to their family and give the family education too. Once we're happy to give the medication, we just want to confirm lastly that the patient is able to swallow. So a simple way to do that is firstly, you can just speak with them and ask them if they have any difficulty swallowing. Another method you can do is by pressing 2 fingers up against your throat, up against the patient's throat, and just asking them to swallow. Once we've done all that, the tablets are ready to be given to the patient. So it's literally, we'll hand this over to the patient, ask them to swallow with some water, and we'll watch them as they take it. Once we see that the patient has swallowed and taken their tablets, we can then sign off on their medication chart and we can document that they have been given their paracetamol.